Goal Uganda has been operational in Uganda since 1979, delivering humanitarian and sustainable development programs that build community resilience and support socio-economic growth. Accountability Can Transform Health, or the ACT Health approach, is a governance program for the health sector that is designed to improve the relationships, the responsiveness, and the responsibility of healthcare providers and healthcare seekers.
It's modeled from a pivoted study that suggests that when community are actively engaged in monitoring service delivery at health centers, those services will improve, leakages will decrease, and then the utilization in those services will improve as well.
The ACT Health project is unique because people discuss things which are real. You talk about what makes you unhappy, you talk about what makes you happy, and there is no fear for the other.
Go has been using the ACT Health approach since 2012. The approach focuses on providing validated information, creating platforms for dialogue, facilitating feedback loops, and promoting behavior change. To begin, data is collected on key health statistics and health services at local health centers. Households are asked to comment on their perception of the services provided by their health centers and to share their own experiences of seeking health services. The information is cross-checked with district reports. The data collected is then used to produce IEC materials and citizen and district report cards on health centers. The citizen and district report cards are then shared and discussed at community and health center dialogues. The findings are validated before communities and health center representatives come together in interface dialogues. Through the interface dialogues, communities and their healthcare providers develop, implement, and monitor action plans designed to address key issues and concerns. IEC materials are used to bring about social behavior change in relation to health practices and health-seeking behaviors at regular community conversations. The findings from the data collection on health services also helps to identify areas for capacity building among health workers. Leaders drawn from the community are trained as community advocates who develop and agree advocacy messages. Finally, community advocates, health representatives, and district representatives hold meetings to discuss the key issues and concerns and keep track of progress and promised changes. At various stages, the community, health workers, and district representatives affirm and reaffirm social contracts that eventually lead to improvements in health charters and health service provision. Ultimately, the relationship between communities and their health providers improves. With better access to information and established feedback loops, we also see an improvement in the responsiveness of health providers. Increased trust and improved social understanding of health issues and health services leads to an increase in individuals taking responsibility for their own health, thus improving health-seeking behaviors.
Communities that benefited from the ACT project, they are more empowered than the communities that didn't. We have had people coming up to even CAO's office to express demand for services that they feel the government should have provided but they do not have.
PM, maternity, no pity serving mon mabe, mon wa maramario, mon yuan la boy meat. La chio momo kero dako na ye, yomi ukonyi kwa mngarasiel. One community wa wang mata. Maloko wa community. Mano beberu, ubalekin community, ke jo doctor.
And then the other issue that also came was that whenever they visit some facilities, the latrines are filled up. They do not have where to go, which we, as the district, we are not actually aware. So that was able to bring to our attention what our community members are experiencing at lower local levels.
When issues were raised, it helped us, the health workers, to open our eyes.
Che karma waberu peng. Kenya maramutiana rio ko beridatiana na laka tie ala joma tie maternity gindo tiga tinu tiji ma yoma ye community joma titun kan ben tiga tinu tiji ma yoma ye community.
I've also seen the number of people we see on a monthly basis increasing. In July we had around 1,200. In August and September we had around 1,300. So last month we were up to around 1,600 people coming for health service delivery.
There's been a great improvement, high increase in the number of antenatal first visits. Mothers are following their appointments.
We had up to around 600 cases of people who came for family planning services. Before then, it was around 100 something. Initially, people used to think of coming for ANC when they see their abdomen is now bulging. During the dialogue, we told them, as long as you know you have conceived 1 month, 2 months, just come and start. So we have seen people who have completed all the 8 visits, and I really appreciate it so much.
The approach goal has adopted is one of the best, where different stakeholders are brought together. The approach can lead to sustainability in the long run, where community members are engaged to identify their own problems and actually even look for solutions themselves. It is only those other things that go beyond their scope that upper authorities are able to come in. And by engaging the district leadership, it encourages proper planning in advance so that issues do not just surprise the district authorities.